Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're discussing an over-the-counter inhaler that often raises questions in clinic, especially when patients are looking for quick relief of breathing symptoms or find themselves running out of their asthma inhaler. That medication is Primatene Mist. If you have seen it at the pharmacy and wondered whether it is appropriate for you or your family, this video will break it down in a clear and practical way. In this episode, I'll walk you through 5 key things about Primatene Mist, its indication, how it works, how to take it, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Primatene Mist and who it's for? Primatene Mist is an over-the-counter inhaler that contains epinephrine. It is approved for the temporary relief of mild symptoms of intermittent asthma, including wheezing, chest tightness, and short of breath in adults and children 12 years and older. The key words are temporary relief and intermittent asthma. This inhaler is not intended for persistent asthma and does not replace prescription controller therapy, such as an inhaled corticosteroid or combination maintenance inhaler. Primatene Mist has a long regulatory history. The original formulation was approved by the FDA in November 1967. It was removed from the market in 2011 because it used a CFC propellant, which was phased out worldwide under the Montreal Protocol for environmental reasons, not because of safety or effectiveness concerns. In November 2018, a reformulated version with the same active ingredient, epinephrine, was approved for over-the-counter sale. Primatene Mist should only be used by individuals who have been diagnosed with asthma by a healthcare professional. Second, how does Primatene Mist work? The active ingredient in Primatene Mist, epinephrine, is a potent, non-selective alpha and beta adrenergic receptor agonist, meaning it stimulates multiple receptor types in the body. When inhaled into the lungs, activation of beta-2 receptors relaxes bronchial smooth muscle. This opens the airways and improves breathing, typically within minutes. Because Primatene Mist is an inhaler, most of its effect occurs locally in the respiratory tract, with limited systemic absorption at recommended doses. However, Primatene Mist does not contain a corticosteroid. While it relieves symptoms, it does not treat the underlying airway inflammation that drives asthma. Using bronchodilators alone without addressing inflammation has been associated with worse outcomes in patients with asthma, including an increased risk of severe exacerbations and asthma-related mortality. This is why this medication is labeled specifically for mild symptoms of intermittent asthma, not long-term asthma control. Third, let's talk about how to use Primatene Mist. Primatene Mist is for oral inhalation only. Each puff delivers 0.125 mg of epinephrine. For adults and children 12 years and older, the recommended dose is 1 to 2 inhalations as needed for temporary relief. Wait at least 4 hours between doses and do not exceed 8 inhalations in 24 hours. Proper inhaler use is essential. Correct priming and inhalation technique are critical to achieving full benefit. Detailed instructions are available in the package insert and on the official website. but here are some main points. Before first use, prime the inhaler by shaking and spraying it into the air, and perform this shake and spray process 4 times. For each subsequent dose, spray once into the air before use. Always shake the inhaler before each dose, since Primatene Mist is a suspension and needs to be well mixed. After each day of use, run water through both ends of the mouthpiece for at least 30 seconds. Then allow it to air dry to help prevent clogging. Medication interactions are important. Do not use Primatene Mist if you are taking a monoamine oxidase inhibitor or within 2 weeks of stopping the MAOI drug. Ask a doctor or pharmacist before use if you take medications for asthma, obesity, weight control, depression, or psychiatric or emotional conditions. The same consultation is also recommended before taking Primatene Mist with other medications or supplements that contains ingredients such as epinephrine, pseudoephedrine, ephedrine, or caffeine, which are commonly found in allergy, cough, cold, or pain treatments. Combining this with the Primatene Mist may increase the risk of cardiovascular and nervous system side effects. In addition, avoid caffeine-containing foods or beverages, as well as dietary supplements containing ingredients reported or claimed to have a stimulant effect while using Primatene Mist. As always, review all prescription medications, over-the-counter products, and supplements with a healthcare provider to ensure safe use. Fourth, let's review the warnings and precautions. Asthma can be life-threatening. Get medical attention right away if you are not better within 20 minutes after use, if symptoms worsen, if you need more than 8 inhalations in 24 hours, or if you have more than 2 asthma attacks in a week. This may be signs of uncontrolled asthma. Importantly, ask a doctor before use if you have ever been hospitalized for asthma. Primatene Mist may cause cardiovascular effects such as increased heart rate or elevated blood pressure and may need to be discontinued if this occurs. The risk of heart attack or stroke may increase in individuals with a history of high blood pressure or heart disease, or in those who use Primatene Mist more frequently or at higher doses than recommended. Ask a doctor before use if you have heart disease or high blood pressure. Consult a doctor before use if you have seizure disorder, thyroid disease, difficulty urinating due to an enlarged prostate, diabetes, narrow angle glaucoma, or if you are sensitive to stimulant-type medications. And finally, let's talk about the side effects and safety. In clinical trials involving patients 12 years and older with asthma, the most commonly reported side effects were tremor, throat irritation, cough, sinus infection, chest discomfort, feeling jittery, bronchitis, and dizziness. Aside from tremor, the other side effects occurred in 5% or fewer of patients, and many showed only small differences compared with placebo. Tremor was the most commonly reported side effect, occurring in about 10% of treated patients, compared with 2% in the placebo group. This is consistent with the expected effects of epinephrine. Although tremor was common, no events were classified as serious and only one was considered severe. That event led to drug discontinuation, but resolved without residual effects. Other side effects of interest, such as chest discomfort, chest pain, and fast heartbeat, were reviewed by the FDA. The number of these events were small, and their generally benign nature is reassuring. The rate of drug discontinuation due to side effects were similar between treatment and placebo groups. However, stop using Primatene Mist and consult a doctor if you develop difficulty sleeping, a rapid heartbeat, tremors, nervousness, and seizure. Overall, when used as directed in appropriate patients, Primatene Mist has a well-established safety profile. And there you have it, 5 key things to know about Primatene Mist, an over-the-counter inhaler designed for temporary relief of mild symptoms of intermittent asthma in patients 12 and older. It works quickly to open the airways, but it does not replace the medical evaluation and ongoing monitoring by a healthcare provider for anyone diagnosed with asthma. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experiences in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.